and let's get started. Okay, so thank you all, everyone, for joining us for Mental Health and Sleep. Today we've got two women from the behavioral health team joining us. Dr. Kim Sundling is a board-certified psychiatric pharmacist. She's got both direct, she's at the top there. She's got both direct and indirect clinical care experience. She is the behavioral health clinical pharmacist at Florida Blue for both commercial and Medicare members. And below her is Debbie Del Rosario. She's a licensed clinical social worker with 25 years of clinical experience in the direct and managed care environment. She's the Director of Behavioral Health Clinical Programs at Florida Blue. And with that, ladies, I'm going to mute myself and turn it over to you.
Awesome. Well, like Patty said, my name is Kim Sundling. It is an honor to be here today to present to you guys, and I'm so glad that you were all able to finally get in. I know that's always a headache, but I appreciate your patience. This will be worth it. I believe this will be a very good presentation for you guys to listen to. It's a very important presentation because I don't think some people know how important and vital sleep is for your health, whether it's medical or mental health. Debbie and I today, we are going to be kind of going over a two-part presentation. What you're going to hear from me is really kind of what sleep is, why do we sleep, maybe some issues that can arise because we aren't sleeping well, and then Debbie's going to come in tips and kind of just tricks of how to potentially improve your sleep and just generally go over that type of information. I just want to specify from the start that these are all general recommendations. We will not be discussing specific tailored to you tips or anything like that. We will also not be discussing medications or anything like that because individual cases are very complicated and those should be discussed with your doctor or provider. So I just want to give that warning from the start and then we can get into it. So why do we actually sleep? And I will say we don't necessarily know why we sleep yet. There are a number of ideas out there, and these are just some of the things that we think what contribute to why we sleep. And one of them is to really process your memories. So processing the information from the day, and then they store them away for later. And that's why if you're like, let's say, studying for a big test, preparing for a big presentation, sleep is really important because then you will actually remember the things when you go to it the next day. So sleep is really important for that. In addition to that, it helps restore your energy. It's when muscles grow. It's when things like healing tissue. It's when we produce hormones. It's also when we grow. When you are growing as a child or adolescent, that's when those things occur because your growth hormones are released at that time. And we also dream. And interestingly, we have no idea why we dream. Like, there are so many ideas, but we truly don't know what the purpose of dreaming. I mean, it does add for some entertainment and things along the way, but no one has really found a sound reason of why we do that. So those are some general ideas of why we sleep. But again, there's probably much more that goes on, but we just do not know it at this time. So before we go into the sleep cycle, I think it's important to understand the circadian rhythm. That is just a very fancy way of saying all of us have these clocks in our body. Not every single one is the same. So like for me, I am very much a morning person, and my clock is probably a little different than some people that are doing it, that are maybe more in the night people. They're night owls. So these are all going to be different. And this is kind of an overwhelming picture that's on the screen. But most importantly, what I want you to understand with this is in the morning when the sun comes up, and when you have that light, that produces awakening hormones. It makes you feel like you're more awake. So that's why dark, because otherwise your brain is going to be producing all of these excitatory hormones and chemicals. And then as the sun, a chemical called melatonin. And this gets released about 2 hours before you generally go to bed and you're getting sleepy. It starts to release, and that's when the sun is going down. So this goes on every single day. There's obviously a lot more things that go on, but I think that's the most important for you guys to understand. In terms of your sleep cycle, if you don't know this already, let's go over it. So most people don't know about this, but the sleep cycle is actually pretty complicated. There's short parts, there's longer parts, and there's parts that are really important and ones that you're probably pretty familiar with. Looking at this here, there are 4 stages when you sleep, and you go through these multiple times through the night. And every stage has a different purpose. And you can see, looking at stage 1, this is typically, I don't know if you've ever experienced this before, but maybe you're like, you think you're awake, but all of a sudden you're jumping, like you feel this big twitch and things like that, and that's just because your body is in the light stage, your muscles are relaxing, and you can see that there, you may twitch. So things are kind of just starting to slow down. Your breathing, your heart rate, you generally are relaxing. Then you go into stage 2, and you can see things continue to progress. Your body temperature drops, your heartbeat, your breathing goes down. If you wear a smartwatch that checks your heart rate, it's really interesting to look at it, and you can kind of just see the gradual decline, and then it increases, and it's kind of a wave. So stage 2 is also pretty light, and then stage 3 is going to be very deep sleep. And that's when it's at the lowest level. It's very important to get into stage 3, and that's really replenishing for your brain, your energy levels, and things like that. So you can see from stage 1 to stage 2 to stage 3, it's just kind of this general relaxation. Everything's just kind of slowing down. Everything is trying to relax and just replenish how you're feeling. And then we go to stage 4. A lot of people are familiar with this stage, and REM stands for rapid eye movement. If you've ever been sleeping by your partner and you've noticed there's eyes going back and forth, that occurs in this sleep stage. We don't exactly know why that happens, but it must be important since it is going on. And this is also the dreaming stage. And it helps wake you up. You can see that your brain is becoming more active, you're dreaming, and blood pressure increases, so your heart rate is kind of going back. And then you go back into stage 1, and you just keep repeating the cycle. And one thing I want to point out here is if there's certain things and certain recommendations that we'll have that really are important to impact this sleep cycle. So let's say, I'll just give an example here, and Debbie will be talking more about these things later on. If you are a snoozer, if you like to snooze your alarm, let's say you're hitting snooze every 5 minutes, you do it for a half hour, that is not the best approach. And the reason why is because you actually go back into the sleep cycle. So you're going to be more tired the more you hit snooze because your body is going back into the sleep cycle. So you're doing it the reverse way. You should always, always just get out of bed if you can. I know it's hard, don't get me wrong. I know it's very challenging. But if you do hit snooze, you're going to go back into that stage 1, and your body is going to think you should be relaxing. So when you get up, you're going to be more tired. And if people have more questions, I'm happy to go over that in more detail at the end of the presentation. So what are some factors that impact your sleep quality? There's a lot. This is just some of the answers. I do have the ones in bold that really do impact your sleep, and people might not know it. I think the stress one most people are aware of, but let's talk about medications. So there's a bunch of medications that people take that often can be sleep promoting, and maybe they're taking them at night. So if you're taking something at night and it is sleep promoting, that's going to help you sleep. However, if you're taking a medication that, let's say, stimulates you a little bit, like some of the antidepressants and things like that, they can make you more awake. So if you're taking those before you go to bed, you're probably not going to sleep very well. So it's really important to understand how the medications are impacting your sleep cycle and things like that. Not all medications impact sleep, but it is important to understand. And for specific, answers and questions about those things, I would definitely recommend talking to your pharmacist or your provider that is prescribing them. The other one on here that I think is really important is alcohol. A lot of people, alcohol makes you really tired, but it actually really hurts your sleep. It makes you not go into that stage 3. So the more you drink, and if you drink consistently, the more it's going to impair your sleep, and the more you're going to feel tired day in and day out. And that's why hangovers, you especially feel really bad because your body doesn't get to the stage 3 and really replenish itself. So I just think that's important. And then the other ones on there, I agree. But if you have questions, please drop it in the chat. And just keep in mind, Debbie will be going over some specifics later on. So what are the impacts of poor sleep? I know a lot of people struggle with sleep. I myself struggle at times, but I've gotten really consistent about good sleep hygiene, and that will be discussed later on. So there are so many things, and I mean, I could talk all day about some of the issues with poor sleep and what they cause. But we're going to be focusing primarily on just some of the more common conditions that can happen. There's a ton of links of poor sleep and mental health conditions and medical conditions. And just in general, a bad night's sleep, I'm sure most of you have probably experienced this. I know I have. I've not done as well at work. Maybe you've tripped. Maybe you've even gotten in a car accident. There's very many things that can happen because of poor sleep. So on this next slide, keep in mind the brief glimpse at some of the illnesses and chronic illnesses that can happen due to poor sleep. You can see development of type 2 diabetes, because if you're not sleeping, your metabolism is not working as it should. So it's really important to sleep, to get good exercise. Type 2 diabetes, cardiovascular disease, which I know that's a very common term, but we think more of like high cholesterol, heart attacks, things like that. So just realistically, looking at this list, if you are not sleeping, your body is not repairing itself, it's not healing itself, and things just aren't going to work very well. It's like when the car light comes on and you just keep pushing past, taking it to the mechanic. It's just not good for your car in the end, and it ultimately results in a worse car, or even you need a new car. So that's basically what these are kind of causing and why they happen. But I think it's important to kind of just understand what can happen if you aren't sleeping well over time. So this isn't like you get one bad night of sleep and then this happens. This is something that if you're sleeping poorly every night, that this can potentially happen to you. So in insufficient sleep, I mean, I kind of already talked about this, but I think it's worth mentioning that there are a number of things, a number of symptoms, I guess I would say, that can happen from poor sleep. I think I've experienced all of these things when I was in college and studying for tests and things like that. And I hope it makes more sense of like why these things happen if you think about why we sleep and just the different stages. So if you're not getting into certain stages or you're waking up during certain stages, it just really can impact how you function as a human. So with that being said, I am going to turn it over to my colleague, Debbie. She's going to talk a little bit more about how much we need and then into actually how to improve your sleep. So thank you, Debbie.
Thanks, Kim. Hopefully you can hear me all okay. So just as you said, what do we need to know? We've kind of learned about the physical components of sleep, but like how much do we need? And actually it's different. It depends on our age as how much or how little sleep that we need. So as you can see on this particular slide, as we're individuals who are younger, so newborns, infants, toddlers, as individuals are growing, they need all that extra sleep to continue down that positive path. So all these sleeps
especially for the young age, includes also nap time. So as you can see right there in the middle is the appropriate or maybe on that recommended ranges. So if there is a newborn, usually 0 to 3 months, we wish they would sleep consistently, 14 to 17 hours, but normally it is broken up during those time frames. As you go down the age group, there are times when actually there is too few hours of sleep. I think that's one that we have seen quite significantly, especially as we get older, as we start cutting down our time and thinking we'll sacrifice our sleep, for example, to try to get everything done. So having too little sleep, so when you're looking at those in the adult age, when you're a young adult, 18 to 65, 7 to 9 hours is the recommended age, or I'm sorry, sleep to have. If you're sleeping over that, such as 10, 11, or even more hours, it actually is something to be mindful of and to be monitoring that as you get older. So we've looked at, how much sleep we have, but not only is it important to understand how much sleep, but is that sleep of good quality? So if you are saying, hey, I'm getting the right amount of sleep, I'm sleeping 7 to 9 hours, but I am just still struggling. I'm still getting up in the morning. I'm still having a hard time moving forward. It may be due to the quality of sleep. So that is just as important, something to consider when you're considering those components. So some things to look out for is that if you are sleeping, some signs that you may feel is when you're waking up, you feel like you didn't have that solid night's sleep. Maybe you weren't resting as well. Maybe you repetitively woke up during the night. There could be opportunity or things where you're also experiencing symptoms of snoring or gasping for breath, and it felt like you couldn't breathe. That shook you out of that sleep indication. And also maybe restless leg syndrome. All of these could be potential physical components that may need to be discussed with a primary care physician to see if they can evaluate or assess some of that sleep concerns, and they might even do such things as sleep studies or sleep components. So some common sleep problems that these might tee up to be, so insomnia. Insomnia is the ability to either fall asleep or stay asleep. You hear sometimes individuals who may have insomnia and they may not be sleeping for several days. So that may be causing them because they are unable to get into that sleep pattern. Sleep apnea is one I think, again, quite a number of individuals have where they are having trouble sleeping because they are waking up gasping or they are having pause in their breathing. Many individuals who have sleep apnea after they've been assessed from a sleep study, they may be evaluated and determined that they may need a CPAP machine, which is a special machine that is placed over an individual and helps to bring oxygen in for them to help them breathe during that time frame. Many people that I know personally and have also worked with, they say it's night and day, and they didn't realize that they had problems sleeping. But when they've got that CPAP in place, they are like a whole different person because they're actually able to receive oxygen and continue sleeping during that time frame. Restless leg syndrome, that is the common thing also where there are aches and pains in maybe your legs or joints that causes difficulty staying asleep. Sometimes people feel they need to get up, they walk around a room, some problems like that they may try to do to alleviate that leg pain that they're feeling. Not the same thing, but there's also Charlie horses or other components that people may feel in the middle of the night that may be impacting. So there's quite a number of different reasons why there may be some sleep problems, and we found that over 50% of Americans actually have some kind of sleep deprivation due to lack of getting enough sleep, and that sleep that they do get is not of the high quality of what it is. One of the things that Kim mentioned, we talked about light, and a good thing that kind of can add to that light capacity is good light and bad light. Especially with the time change, we just had that going through. Our body has adjusted and is aware of times to be alert by the nature of light coming in through a window or natural light impacting them. So that exposure to light has a really powerful effect on how we're able to sleep. So with the natural light in the morning, you get that feeling that, okay, it's time to wake up, time to move forward, and getting ready for the day. It's recommended that having at least 1 hour of natural light, whether in the morning or afternoon, can also help, again, acclimate your body to the norms of that light structure and being able to move forward. At night, the opposite is then to get you kind of ready to wind down and getting used to getting ready for sleep. It's recommended to dim the light. So about an hour or so before going to bed, it's recommended to turn off the screens, turn off the TV, stopping all those interactions because that blaring light that is brought in continues to feel that you need to stay awake. So finding opportunities to start winding down at the end of the day is great. And it's important, or why we also wanted to bring this up, is that, some of our patterns of how we used to work or have worked in the past is different now. A lot of us are now working from home, so some of our normal ways of obtaining natural light, of walking to our car, driving around to our job back and forth to different locations has changed. So sometimes being mindful of those times that we need to actually go out, not just to get the great exercise, being able to, walk around in natural air and things like that, but also of receiving that natural light. We do have that ability, and great, especially here in the state of Florida, where we do have an opportunity to receive that on a pretty consistent basis. And being able to receive and impact that will help you with that ability to get your body used to the times when it's supposed to be daylight, and then as you progress to the nighttime, getting ready for the bed. So other pieces that may be impacting our sleep, not only have we talked about, we need to have good, we need to sleep at the right amount of time. We talked about having good quality sleep. But, okay, we've done the right thing. We've turned off the lights. We're getting ready for bed. We're getting ready to do that. And we lay down and our mind starts going. It is that constant stress that sometimes can negatively impact our sleep. Sometimes it's just finding that moment you've been moving around all day, constantly moving, keeping active with whatever is going on, whether it's life, getting work, finances, family situations, relationships, children, anything along those lines. You finally get a moment to pause and sit down and lay down, trying to relax at the end of the day, and your mind starts going nonstop. It's the piling on of that stress. You are focused on the different components. That's the stress. Finding ways to kind of refocus so that your mind doesn't keep spinning may be a good way of trying to work through, instead of using the time when you're in bed to work through your stress or concerns, and maybe finding a different time, taking time maybe also at the end of the night, if your mind is racing a lot, having a notebook or a piece of paper nearby, writing those ideas or concerns that you have at that time, write it down on that piece of paper. Don't turn on the light, don't turn on your phone, anything like that. Just write it down, saying, okay, I've got that now on the list. I'll address that in the morning. Moving it to a different area may help just a little bit to help moving that forward so that stress doesn't keep piling onto your shoulders that you have. So some other areas of recommendations that we have for a better sleep, we've talked about it pretty consistently. So the first one is be consistent. My family crazy, but I pretty much go to bed about the exact same time, and I get up about the same time, whether it's a work day, weekend, holiday, anything along those lines, because it makes me feel better. I get my same 8 hours, of sleep. Try to, and 6 to 8 hours of sleep during that time frame, and knowing that I have a consistent time of when I'm going to bed, when I'll be waking up, kind of helps with that sleep pattern, and you start feeling naturally tired as it progresses during that area. Also with the consistency is also having a consistent meal time. It may not seem as impactful, but as you are thinking about when you are hungry, when you are eating, times that may be happening is if you eat a meal at the same time all the time, your body is able to digest that pretty consistently, so it doesn't cause any simple as, reducing your intake of water or fluids at a certain time. It can also hopefully alleviate you from getting up in the middle of the night using the restroom from that side. So again, kind of being consistent on those patterns, getting you into that practice on it. In your bedroom, looking at your bedroom itself, making that kind of your sanctuary as much as possible. Keeping it quiet, keeping it dark, having it at a relaxing indications, and keeping it at a comfortable temperature. Sometimes that might be a fight. Some people might like it hot. Some people might like it cold. But keep it where you are at a area that you feel comfortable and it's relaxing. Many individuals, indicate that it's not a great idea to have things such as a TV in the room. If your work desk is in there, turning off any notifications, anything that may be indicated in there, because those pings or notes might pull you out of that relaxing, quiet sleep pattern. So kind of, if possible, moving those components to truly just leave the bedroom to be able to be asleep for that. Also, a good way to keep a better sleep is remove electronics. It's hard, I know. We are driven by our phones and being able to have that access so easily at our fingertips, but removing those capacities somewhere else or not turning them on or turning them away at a certain times is a great way to, again, move into that state of it's time to sleep, time to relax. I know I have notifications on my phone that I turn off, so it's a sleep pattern or do not disturb, and at a certain time that I do not let any notifications except significant family members for them to come through on my phone, so that constant ping or that constant notification doesn't impact my sleep during a specific time frame. Other things for a better sleep, avoid large meals. We talked about that a little bit, kind of having consistent meals so it doesn't feel weighted in your stomach or trying to digest at that time. It's recommended to not have caffeine. I know it impacts individuals very differently, but it's always great to be mindful of, trying to reduce caffeine after a certain time of the day. Again, hopefully allow you to not be as wired later on in the evening, being able to relax. And then also alcohol, as Kim mentioned, about the impacts that causes. Staying active during the day itself, keeping yourself active, exercising, working out, things like that, again, keeps that momentum going, so it helps at the end. Sometimes I know people even exercise, that endorphins may cause them to be excited at the end. So being mindful, being able to do that, watching the exercise components on there will be able to help you get ready to sleep. And I know Kim mentioned that, and we talked about that. Do not hit the snooze button. I am definitely one who falls into the realm of using my snooze button. It makes me feel like I'm sneaking extra sleep in, but it does not be a quality sleep. I know as many times right when I'm about to fall back asleep, I wake right back up when that snooze alarm is back on. So it's recommended for a better tip. Don't follow my behavior, but recommended to do not hit the snooze button at that time to continue that progressive sleep pattern. And that is the end of our presentation. We are happy to be able to answer any questions or concerns anybody has.
Okay. Well, I'm so happy we were able to get through everything. We've got a few questions. So first one is, does poor sleep affect men and women differently?
Yes, I can take it, Debbie, because there's a lot of pathophys that goes into this. Short answer is yes, and it's mainly related to hormones because men tend to have more testosterone where women have more estrogen. So a lot of it is related to that cycle. Men that have poor sleep, they can have low testosterone, which can lead to a bunch of issues related to just male anatomy. And then females, it can really mess with the estrogen, which can cause a bunch of different issues, even early menopause. And one thing that I think is important just to kind of understand, lack of sleep can really also impact fertility, especially in the male population, and that is a little different than the female population. One thing I will say is that females tend to have the more likelihood of having sleep issues, yay females. So just that is kind of just a very general overview, but yes, they definitely can be different in men and women. So.
Okay. When you were talking about the natural light, a question came in, what counts as 1 hour of natural light? Is that being out in the light or just seeing it? And I'm assuming maybe they're thinking through a window. what kind of exposure counts?
Yeah, natural. If you can see it, if you can, it's alerting your brain that the sun is out, the sun is there, instead of staying in a closed off room. So yes, seeing the light, there's that vitamin D ability if you're actually outside and receiving that capacity as well. But actually, if you can see, it through a window or anything, it brings out that. So that is a viable option.
Okay.
And just, Patty, sorry, one thing to add on that, because I do live in Minnesota, where, it's kind of hard to go outside sometimes because it's negative 50 degrees. Yes, that's a real temperature for you. You guys might not be aware of that. That's a real temperature. One thing that can also really help supplement this is they call them light boxes, and you can sit in front of them for 15 to 30 minutes in the morning. It has to be in the morning. Don't do it at night, because as you've learned today, light can be very stimulating, but keep in mind with the light boxes, I would definitely talk to your doctor before using them, especially if you do struggle with a mental health condition. It can kind of mess with some of those things, but that is also an option if you just aren't able to go outside. And maybe in Florida's case, it's because it's so hot, which is the exact opposite of my problem. So, yes.
Wow. Okay.
Yeah. Tied to that, there is sometimes individuals have what's called a seasonal affective disorder. So sometimes not being able to access or see the sunlight can cause you to feel depressed or down or anything. So again, light has such a lot of positive contact and things that you can pull from it. So, yeah.
Okay.
Thanks, Patty.
Thank you. What suggestions do Debbie or Kim have for having a dark room but wanting to have some natural light to help wake you up in the morning?
I have ideas if you don't.
I don't know. It's like, because I personally also have dark blinds, but they don't cover my window completely, so you still are able to get some of that light kind of through a draft. It's through my personal thing, but I don't know, Kim, if there's something more specific that you benefit with.
Yeah, so one thing, that's a great recommendation, Debbie. I know a lot of people do that, but there's actually alarm clocks out there now that it's a gradual sunrise, and it's the exact light of what the sun would be portraying, and you can, obviously have it go whenever you need to wake up, but that is a way to have both a very dark, night shade, if you want, in addition to an alarm clock. They also make lights that you can program on your smartphone for them to gradually wake you up. That's actually what I do. I have a smart light bulb. That's the world we live in today, but that is a really good and effective way. It honestly wakes me up better than sound sometimes. So that's just another option. And I'm sure there's a multitude of options out there, but those are just some suggestions that come to mind. So yeah, great question though.
Okay.
Yeah.
So we did have a question that was talking about medication, Kim, and I know we initially responded to that person to please discuss with their doctor. But he did come back and say, I just wondered if you've heard that prolonged use of Ritalin could in some cases possibly cause insomnia. I didn't know if you wanted to touch on that at all.
So I don't want to give specific medication advice. What I would really encourage, and I guess let me explain kind of why I don't want to give specific advice regarding medications, and hopefully this will help a little bit. But I do not know, if you're asking me a question on here, I do not know your full history. I don't know your lab values. I don't know what other medications you're taking. I don't know your past medical history. So I can't safely tell you if that is causing it. I know clinical data, but I don't know, your specific case. So I don't want to cause you harm. And that is why both Debbie and I do not answer specific, very specific cases. So I know it seems silly, but there is a reason. I don't want to cause you harm. So what I would really recommend is whoever is prescribing the Ritalin, have that conversation with them. I think it's really worth it, especially if you have noticed changes over the years. That's what I would recommend. But I hope that makes a sense of why we are limited on that. So
perfect. Okay, there was a question that came in asking if it matters if you get 4 hours of sleep at a time. So it sounds like perhaps their sleep is interrupted.
It's best to just do it and go. Sorry, Debbie, go ahead.
Yeah, that's where I was going exactly. You know, that earlier slide that we were showing that talks about the grouping of sleep. You know, it does have for the kids, you know, that there are naps, but as you are getting older, we were not supposed to take naps, but I know we always do. But that does not include in what is expected. It's usually that full length, you know, doing 6 consecutive hours, 7, 8, 9 hours kind of at one time is a better sleep pattern.
Okay. And just to add to that with, sorry, Patty, with the sleep cycle, is if you're waking up in the middle of, like, let's say cycle 3, your deepest sleep, it's going to be really hard to wake up. So it's better to be going through a couple cycles for you to actually feel refreshed. So if by doing it in chunks, it's probably causing more harm than good. And I understand, like, sometimes, like right now, I have an 11-week-old puppy. I am not sleeping through the night right now. Or if you have a baby, I understand there's certain life circumstances where you can't. So if you can, it's best to get that full time. But like I said, I also understand that sometimes life gets in the way.
Okay. Now, and I think you covered it in one of the slides. Someone asked how many hours should you actually get of sleep. I believe that Barr had like maybe a 7 to 9 for adults. Am I right thinking that was what was there?
Right. I'm going to go back to the slide presentation. Oops, there it is.
I mean, it was a little hard to see.
Oh, okay. I'm sorry about that. But yes, okay. Most adults are 7 to 9.
Okay. What should you do if you've had established some bad habits and you have insomnia?
So bad habits, it sounds like you already know of some things that you might want to change. So, you know, if there are opportunities such as, you know, if it is the phone or things like that, start making those changes, but then talk with your doctor, seeing, you know, kind of what recommendations or anything that they can help you with to overcome that, to get back on a normal sleep approach, I think would be the right recommendation I would put out there.
Okay.
And there's also a lot of there's also a lot of there's apps, digital like self-management tools and things like that can really help you with sleep.
All righty. So let's go to where. Okay. So the next question I wanted to ask was someone was asking, any thoughts as to why I wake up at the same time each night with anxiety? Usually it's anywhere from 2 to 3 a.m.
I have heard about those. I don't know if there's a doctor answer or Kim, that anything that you're aware of. But I think again, if you're waking up with anxiety or you're feeling that way, you know, one of the good things to be doing kind of beforehand is, you know, if you're anxious about something, again, that sleep journal or some kind of documents really close by, I think sometimes can help move your stress to something else and saying, okay, I'll deal with that in the morning. There's nothing I can do about it today. Just some way of kind of tricking your mind to be able to say, okay, I have to sleep right now. These concerns that I have about whatever stress, whatever anxiety I have, I placed it in that document. I'll look at that in the morning when I get up at 7 o'clock, 8 o'clock, whatever time that you're planning to wake up, just to kind of help a little bit with that.
The only thing I would potentially add, just thinking like from a neurotransmitters and things like that, make sure if you with anxiety, like if you are wanting to write something down, don't go on your phone because the light from the phone is going to stimulate you. So if you're, let's say maybe you're playing video games right before you go to bed, you're watching the TV on and there's an action movie going on, all of that is going to contribute to that because all of it is released. So sometimes, especially like if you get up and you're on your phone every time that happens, it creates a habit, and people are very habit forming. I mean, I have habits. Your body is automatically going to care of teach a man of a bell and don't give them food, they still start to drool. So humans do that too. Well, they don't. Well, drooling is different, obviously, but I mean, like your body is trained to wake up at that time if you are doing things that are stimulating to you. So it occurs though, like I've heard it before, like Debbie said, but definitely think about other things that may be contributing to that stimulus. Great question, though.
Okay, let me ask Debbie and Kim, do you have some time to go a little bit over, since we had the issues at the beginning, to answer some more of these questions? Okay. Oh my goodness, that seems to be a driver of sleep deprivation, true. So someone says we've got 4 grandkids living with us, so it becomes an issue. Any recommendations for getting the kiddos to bed and to sleep?
I know, again, kind of what we've been talking about, patterns. You get into, I have 2 kids, and, some of the things that I did to kind of get them used to is like setting a set time. You could be reading a book, getting your bath, and then you have 5 minutes, and then, you're going to be in your room. Giving them 5 minutes warnings, depending on how anxious or they may be having, might, again, just kind of get them into routine that we're going to be going to bed at this time. One of the other things that I put into kind of my household is that you are in your room. I don't care if you're sleeping or not, but the lights will be off and you'll stay in your room until the sun comes up in the morning. Again, that hopefully will give them a way of doing a pattern. Once they don't have that stimulation, sometimes they can move all those room and they're stuck in most of the time, that they will also hopefully fall asleep during that time. Is a possible recommendation to help with that, because again, especially, unfortunately with babies, they obviously would not be the right way, but as they're able to help manage a little bit of their own, that might be some opportunities that they can help out with.
Okay.
Whatever's possible.
I've heard, stomach sleepers, there is problems that they may have overextending their neck by your head being elevated, but some people like that pressure. Individuals who are pregnant, obviously sleeping on your back is also not a comfortable position because of that pressure on all the important organs as you have that baby as well can impact it. But most of the other ones, it really depends on kind of what feels comfortable for you. Sleeping on your side, sleeping on your back. I think most of the time people shift all during the night anyways, so you may not wake up in the same position you were in the morning.
And one thing I will say, I think, you can sleep however, makes it's comfortable. I'm a stomach sleeper, so But one thing I will say, if you have sleep apnea and you're sleeping on your back, you are more likely to stop breathing if you're sleeping on your back and you're not using your CPAP. So if you are someone that perhaps struggles like with breathing and you're sleeping on your back, it's definitely worth talking to your doctor. But that is one position, if you do have sleep apnea, that you are more likely to stop breathing in the middle of the night and you will not feel rested because you're going to be messing up your cycle every time you wake up. So that is one comment I would make about a disease-specific thing. So.
Okay, great point. Does eating dairy before bed disturb your sleep pattern?
If you're lactose intolerant, maybe, but I think it would just kind of your own kind of health, nutrition patterns that you have. I mean, I think what is the old wives' tale has been, a cup of warm milk can sometimes help you go back to sleep. I don't know if that would always work, but, there's kind of whatever works for you.
Okay.
If you have, if you think about milk, I guess another one is if you're doing ice cream, for example, there's a lot of sugar. If you're starting to ingest a lot of sugar that late at night, could give you, again, more energy during a time when you're trying to calm down and rest instead. So kind of depends on what form milk is in.
Okay. Is there a secret as to how to turn your mind off?
There is cognitive behavioral kind of sleep ideas. Again, some of the common practices, again, there's apps out there trying to do mindfulness, doing some calming exercises, trying to focus on something else, deep breathing in, and then you exhale it out. Kind of very rhythmic kind of approaches sometimes can help clear your mind. So sometimes meditation techniques that they have could help with some of those activities.
And Debbie mentioned this already, but writing stuff down, like if you have one racing thought, like, oh my gosh, I have to remember this tomorrow for work, like have a notebook. I do, because my mind's always going all over the place at night. Write it down. Another idea is to listen to like really relaxing music, like ocean waves, white noise, rain, thunderstorms. It really does help you kind of just focus on that. Because I know meditation is really hard. Like people think it's very simple sometimes, but it's extremely hard in my opinion. And sometimes the music can just be, or sounds like just ocean waves. I focus on breathing to the tune of the ocean waves and kind of match it, and then I usually can get my mind to shut off. That's helpful for me. It might not be for everyone, but just a thought.
Yeah, I know sometimes sometimes as I'm going to bed, if I'm thinking about all the things I have to do the next day, I do the brain dump. I just write it all down and then feel like, okay, I've got that off of my mind, and now hopefully I cannot be, ruminating on it while I'm trying to fall asleep. So I think that's a great suggestion. So when you were talking about the noise, I did see a question come in saying, is it bad to sleep with headphones or something like white noise or music or TV to help you sleep?
TV, yes. It's not good to sleep with the TV on and it's not related necessarily to the sound. It's more the light, because we've mentioned this multiple times today. The light is very stimulating to our bodies. So it's better to sleep with no light. As for the headphones, I would say as long as it doesn't have a cord and you risk strangling yourself, well, that would be my only hesitation. But like, let's say you have a partner or, a spouse beside you and they can't do noise, then I think headphones are fine. It's just comfortability as well. I would not be very comfortable with headphones in, but whatever helps you, but no on the TV. I'm sorry. I know a lot of people sleep with the TV on, so.
Yeah, okay. Someone said they have a hard time falling asleep. They've tried going to bed at the same time, turning everything off. Nothing seems to be working. Do you have any other suggestions?
I know, not that it's full, but, another natural kind of remedy, smelling lavender sometimes is a calming component that helps with it. Again, when you're thinking about you're going to sleep, you're trying to find ways to kind of slow down, whatever that looks like. If it's, again, soft music could be doing that. Maybe it's a warm bath before the night. Sometimes people work out and they've let out all of their energy and now they can rest. Whatever seems to be the right way of kind of releasing the bent-up stress that you may have had during the day. And it's like, okay, it's now time to relax and give it a time. And also you were talking about the time that you consistently go at the same time. Hopefully you try that for longer than just a couple of days. Is it seeing the pattern sometimes happen after about 21 days, 30 days or so? Sometimes we'll get you into that rhythmic pattern of it. So maybe it may need to take a bit of time to do some of that. I don't know if you have any other recommendations, Kim.
No, I think those are all great recommendations. I would say if you're really struggling, like with falling asleep, you maybe need to go to bed at a different time potentially. Like sometimes we kind of get a second wind. At least I know kids do. They'll suddenly be tired and wow, they have a lot of energy. So it's important to kind of go to bed when you're tired. I mean, maybe like 30 minutes later. Potentially, but I do agree with Debbie, consistently trying to do that. And then, we haven't mentioned this, but if you're truly struggling with like falling asleep, if you're doing everything correctly, like please seek out your provider or your primary care provider, because there's so many like not just medication, but therapy options. The therapy is actually proven to be more effective than medication. So you could work with a therapist. So just keep that in mind. We did like very general tips, but there are specialty services out there if needed, especially if you're doing everything right and it's like, come on, I just want a good night's sleep. There are sleep doctors, there's sleep therapists, they are there to help you. So definitely worth mentioning.
Absolutely.
Okay. Would working out in the evening affect sleep?
Again, it goes back to the person. I mean, it could go, sometimes people get higher energy, adrenaline, and, I know Kim's works out all the time, but sometimes it releases energy. So I've seen both extremes. I could not work out late at night.
Yeah, and just a little like pathophys, I should say it also really depends on the workout. I mean, if you're doing yoga, which tends to be a little bit more like in tune with your body. But if you're like me and running like 8 miles before bed, that's probably not that smart of a decision. And the reason why is because of adrenaline. So when you work out, your body releases adrenaline. It also releases dopamine, which are very, very, very activating. And it takes a long time for you to come down. However, like what Debbie said, there are some people that actually relaxes them. So it really depends on the person. I would say majority of people, it is not a good idea, especially if you are having trouble sleeping. Then I wouldn't exercise, but like if you feel better, then it's probably fine. It just really depends person to person.
Yeah, okay. How long should a nap be?
I know the previous, or what I've seen in literature, a 20-minute nap, and sometimes, or short siesta can be helpful, and kind of give you that time to get a quick refresher. I don't know if there's any other. I think some people take a 1-2 hour nap sometimes, around 2 o'clock or 1 o'clock in the afternoon sometimes. Kim?
Okay. Yeah, my concern with taking, and I mean, there are some people that just have to take naps. Like there's some people like that can take naps. I literally cannot nap. Like I just sit there and I'm like, what am I doing? I need to be doing all these other things. So like props to people that can take naps, first of all. But if you think about what I talked about early in the presentation with the sleep cycle, if you're taking a 10-minute nap, you're only getting light sleep and your body thinks it should have like an hour more potentially, or even longer, 2 to 3 hours more. So it can be harmful, or you might not feel rested even though you took a nap. So I think it's important to kind of consider those things. And as for length of nap, if you take like a 15-minute cat nap and you feel great, that's fine. Like as long as you feel fine after it, I mean, it's not going to harm anything. But if you're taking a nap and you feel tired, that means that you're waking up in a cycle that is like, hey, I need to go back to bed. So I would just kind of check in that way with your body.
Okay. And I think something else just to add is that, are you doing this routinely? Like I think we've all had maybe a rough night, or that we've had, reasons that you couldn't sleep that well and you need something to, again, because you feel groggy. So I kind of can see that. But if you're consistently needing a 2-hour nap every day of the week, that might need time to reconsider, what your current sleep pattern is.
And also keep in mind, if you're really tired and needing to nap every day, there might be something going on in your normal, like at night sleep cycle, things like sleep apnea, maybe you're not getting into that deep sleep. So just really consider what is going on at night and why you're taking a nap during the day.
Okay. Somebody asked if there's any sort of an alternative to a CPAP machine. Seems like saying it doesn't help let you sleep because the pressure of the air that comes out increases, so they're waking up a number of times. I don't know if you're aware of any alternatives.
Well,
I'm not familiar with any.
I am pretty familiar with like CPAPs just because of where I previously worked, but there are alternatives, mainly related to the type of mask that you wear. Most people actually do really well with a CPAP. They actually sleep better than they've ever have when they finally get a CPAP. So what I'm hearing is that your mask is not fitting appropriately on your face. There's smaller ones, there's larger ones. So I would definitely talk to the doc that diagnosed you with sleep apnea and got you the CPAP. But there are alternative options, but they are not as effective as the machine ultimately. So.
Okay. Listen, we're 15 minutes over, and there are quite a few more questions. So I'm going to get the questions to Debbie and Kim and ask them to answer them and get that out to everyone. And I just want to apologize for the technical issues. I'm trying to find out from our webinar support team what happened that prevented so many of the people from coming in. Thank you, Debbie and Kim. And we have an evaluation. We have some handouts. I'll get the handouts to everybody tomorrow. I hope you have a great rest of your day. Okay?
You as well.
Thank you so much.
Thanks. Bye-bye.